Well, I think that concludes it.
Okay, I got some questions. I've got the finance minister, transportation minister, and Adriana LaGrange and Jason Nixon who are divvying up the health minister. I just think it's important for you to know a little bit about what we're doing on healthcare. We're focusing. So I'm going to monologue a bit, and then I'm going to let each of you monologue a bit. One of the things that we discovered in healthcare is that our hospitals have pretty much become the multi-service center for whether you need to get, if you don't have a family doctor, you go to emergency room. If you have a mental health condition, emergency room. Addictions treatment, emergency room. You're homeless, emergency room. You go in because you've got a fall and you need to go have a long-term care center and it isn't available, you're in the hospital. And so what we realized is that we needed to get our hospitals to be hospitals again. So we have mental health and addiction that is going to be creating special service approaches for mental health and addiction beds, adding 750 plus beds that will allow for those patients to be treated in an appropriate facility. We also, thanks to Adriana LaGrange's great work, we have nurse practitioners who can now take on new patients. We have almost 60 nurse practitioners who have set up their family practices. They have to have a minimum of 900 patients, which is amazing. Despite all of the noise that you heard in the media about the doctors, we did get to the finish line on a doctor's deal, incredibly successful. More than 800 doctors have signed up to that. 900 doctors have signed up to that now. And so that will also help shore up our robust primary care system. So now we want to make sure that we are focusing on prevention so that we keep people out of hospital on both of those fronts. Now, I have to let Minister Nixon talk a little bit about some of the things that he's discovered as he's taking over the assisted living portion of healthcare, because the number of people who have been in hospital for extended stays would just water your eyes at how much of a problem that we're seeing. And I want him to explain to you the nature of the problem he's trying to fix and how he's going to go about fixing it. So why don't you talk about it, Minister Nixon?
Well, first of all, I want to reiterate that what we're doing is supporting Minister LaGrange and the incredible work that she's doing, refocusing the healthcare system. And the promise that the Premier made to you to fix what has happened with Alberta Health Services, our healthcare system is well on its way. And so we see our job right now to support the work that Minister LaGrange is doing. And we really think if we get our end of it right, that she's going to knock it out of the park on the rest of it. We're going to have the best system in the country. And what we found, and the Premier's exactly right, there's literally upwards of 1,600 people a day that are inside Minister LaGrange's hospitals and acute care beds that should not be there. And the system has developed to not have any urgency at all to move those individuals along. Now, it's really quite appalling because they end up being in a bed that is not good for them, where they're deteriorating, they don't belong there. You don't want to be in an acute care bed unless you're in an acute care situation. It's costing us as taxpayers more than the services that we provide elsewhere. And so we're coming in with a new organization, Assisted Living Alberta, to support, to make sure everybody ends up in the right spot to be cared for. And ultimately that's going to keep the system safe. And we have to do this because what we have found, first through the work that Minister LaGrange has done and then us going in afterwards to begin to do our work, is that there are people on your dime living in acute care hospitals for upwards of 800-900 days that have been out of acute care for 900 of those days. So maybe they've been there for 5 days for an acute care situation, and they continue to live inside the hospital while you're paying them an extraordinary amount each and every day. And at the time, there seemed to be no urgency from Alberta Health Services. We found one individual, Minister LaGrange and I's team, who's been living there with security watching them, because I guess they have some behavioral issues, but they're allowed to leave the hospital at will, go back, visit family, go and go to the mall, come back and forth, and the HS seems to think that's an appropriate way to use your taxpayer dollars, and we're going to fix that to make sure that those acute care beds are available. I don't know if you saw in the newspaper, the Edmonton Journal about a week ago, there was an individual who bragged about insisting on staying in acute care so they could vote. And Alberta Health Services thought it was appropriate just to allow them to have that bed for that period of time. So we are not going to tolerate that no more. We're going to go in and make sure that our acute care system can keep care of the people that needs to be kept care of, and our grandparents, our moms and dads, and those that need our help are brought to the appropriate bed to receive the services that they need for an appropriate price and make sure we have the best healthcare system in the province.
Great. Incredible. And I'll just say one more thing about the work that Jason is doing too, because we know that we have some incredible partners in the community. We think we're probably about 12,000 beds short between now and 2030. And so there will be a robust plan where we are partnering with communities so that we can build more of those beds. I just point that out to you because I know many of you have need in your community as well. But we have to first fill the beds that are empty. And AHS was supposed to be keeping track of all the empty beds that are in facilities. They did not do that. So when Jason went in, he realized he had to hire a call center to phone around to find out where all the empty beds were. And I don't know if I'm allowed to say how many beds there were that you found.
Go for it, Premier, why not?
Upwards of 1,500 beds.
North of 1,500. Think about that. Sorry, Premier, to interrupt you.
Yes.
Spending billions of dollars, Minister LaGrange, to make sure that the healthcare system works. And when we call to find out the capacity for continuing care outside the hospital, Alberta Health Services had no data on the amount of beds they had. Mr. LaGrange, I know you found that in other areas. It was a real challenge. And so we've had to literally bring in our own call centers to go get capacity numbers. And frankly, further than that, we have staff, including political staff, and occasionally myself, going door to door for those facilities till we find that capacity. But I hope that shows you the dedication the Premier has to making sure that we get the healthcare system fixed.
Now let me set it up for Minister LaGrange as well. So can you imagine if we're able to take those 1,500 people who should be in continuing care beds and actually move them into the continuing care beds that are open, freeing up the capacity in hospital? That's part of the reason why we're not racing to build a bunch of brand new hospitals. We have to make sure that we're using the existing acute care capacity to the way it's supposed to be used. And that is one of the things that Minister LaGrange is working on. So over to you.
So what I would add to that is, you're absolutely right, because we have these 1,500 patients that have gone through their treatment, they're called alternative level of care patients, that are blocked in beds. It blocks up all the other beds. It backs all the way up to the emergency room. It's why we end up having people that end up in stretchers in the hallways, etc., because they can't get into a bed. We have done a deep dive, actually, what you were saying, Jason, we have actually sent our CEO and the new acute care Alberta CEO to physically go in and look at who's in the bed. Because sometimes it's listed as an acute care bed, but we have somebody who's there, who's now living there for a very extended period of time, and we need to get a better understanding of why that is and how we can get them out. So working together, that's the one thing that I'm seeing. It's really exciting to have a cross-ministry approach. That's not happened before. We have everybody around the table solving real issues. When you think in terms of a $4.9 billion hospital that was proposed for South Edmonton, that was a 400-bed hospital. If we have 1,600 ALC patients, that's 4 hospitals that we can avoid building. We also are finding that we have shelled-in space. We also have floors in hospitals, current hospitals, that we can develop quickly to add capacity. Besides adding more staff, the agreement that we just negotiated with the UNA, which is the nurses union, that is going to also, besides adding more nurses, we can add more supernumerary nurses, which are nurses that have just completed their training. We're going to hire 1,000 Alberta trained nurses every single year here in Alberta to add and build our numbers. We're also, with the work that we're doing in Grand Prairie and Lethbridge, we're going to add an additional 100 doctors a year. When I first started, we were at about 10,600 doctors. Well, we're now over 12,200 doctors, and that number keeps climbing. So very soon, we are going to make sure that every single Albertan has access to a family care practitioner, whether that's a doctor, a nurse practitioner, or someone else as part of the team. It's really exciting. It's what keeps me going, even though there's a lot of other crazy noise going on, because we are actually solving real problems, and I'm hearing such great stories. I hope that if you have some of those great stories, you'll share them with us.
One last thing I'll say is, you may have seen an announcement that the minister delivered a couple of weeks ago with Siemens. As they replace their equipment in cancer care, they're going to replace it with the very best technology that is going to be AI assisted. Their aspiration is to move from diagnosing cancer to treating from 2 weeks down to 2 hours. That is where we're going aspirationally. So I know that it is, it's a long haul.
If I could add, it is the biggest partnership that they are doing globally, not just in Canada, not just in North America, but globally. They are excited. Some of the work that we're doing, even in adding new cancer drugs, etc., it is so exciting. It is saving lives, and Albertans are on the cutting edge of it. So I'm so excited about that.
Well, and I can tell you guys, AHS was not going to do this work. They absolutely weren't. The thing that we are surprised by every single day is, when was one of these high-priced $600,000 a year managers going to tell us about any of these problems in the system? And that is the answer. They never would have. So I know that it's a long haul. There's been a lot of work that we've done. Stay with us with a little bit of patience, a little bit longer. It's going to be extraordinary when we finish all of the refocusing and finish all of the pieces that we need to get this system working. I think it's going to be the best system in the country.
And if I could supplement, we have some of the best doctors, nurses, healthcare practitioners, healthcare aides, etc., in the world. And I can tell you that even firsthand, because I have gone through an eye cancer journey. We have eye cancer oncologists here that treat all the eye cancers, not just for Alberta, but all of Northwest Territories, all of Saskatchewan, part of Manitoba, and British Columbia, because we have that expertise right here in Alberta. But we do not celebrate enough the great news stories, and we're going to change that. We're going to start celebrating the great things that we do right here.